Tuesday, April 21st. I'd like to welcome you to our broadcast to give you a live update of everything happening in Bellingham relative to the COVID-19 pandemic. I'm going to start by turning it over to Bruce, Department of Health, to give us the updates on what the statistics look like.
Good morning, everybody. Mark couldn't be with us today, so I've got his handy sheet here with the updates. To date, we have 39,643 total cases in Massachusetts, with 1,809 deaths. We have 169,398 that have been tested. In the entire United States, there are 746,625 total cases, with 39,083 deaths. It's quite a few numbers. We're still on the incline. Massachusetts is considered the third in the listing, with New York being number one and New Jersey being number two. So we're still on that incline. So everybody, please, pay attention to the social distancing. Wash your hands. If you got them, wear your masks out in public, and try not to go out unless you need to.
Great, thank you, Bruce. Esther, I'll turn it over to you.
Good morning. So we did have a few new cases come in over the weekend, which brings our total to 176 residents that have been tested. 46 of those have been confirmed. 24 are currently active, and 21 recovered, with 2 deaths in town.
All right, thank you, Esther, for that update. Next, I'd like to welcome our special guest, Courtney, who is here to give us an update on what Devlins Tavern is doing during the pandemic. Courtney.
Hi, thank you so much for having us.
Yeah.
It's been, it's been a lot. We're trying to do a ton of sanitizing. We've made sure that we've wiped everything down. Everything looks great, sparkling new in here. We're also doing a no contact delivery and takeout. We're using gloves for everything. For the next 2 weeks, we're also doing Vets Eat Free here. We appreciate everybody's support during this time. I hope everybody who isn't feeling well gets better. It's been, we just want to make sure that when everybody does come back, they feel comfortable. So there has been a lot of cleaning going on here, and masks and sanitizing and wiping down. So, we're just trying to make sure we're all working together as a team.
That's wonderful. Thank you so much for offering that for our veterans. That's really very kind of you.
Yeah, no problem.
How do folks find your menus? What's the best way to see what you guys are offering?
So you can either go online to our website, or you can go to Devlins Tavern on Facebook. Also, we post our specials every day on the Devlins Tavern's Facebook page. So all you have to do is like the Devlins Tavern page, and then our specials get updated every day of what we're having, because we do have new specials daily.
Perfect. Thank you so much, Courtney. All right, I'm going to turn it over next to Dennis for the questions that we've received from residents in Bellingham.
Yeah, we did receive a few in over the weekend, and one had to do with, actually they both really had to do with testing, but one, Esther, will there be any testing in the 2 senior housing complexes in town, Rentham Manor and Depot Court, I guess is what they're referring to?
So at this time, there's nothing scheduled like you would see in the typical nursing facilities. However, if any of those residents are experiencing symptoms, they are advised to contact their healthcare provider, who will then place an order and instruct them where to go be tested. But there's nothing like you've seen with the National Guard coming in to test all of the residents at this time planned.
Esther, we hear an awful lot about the regional testing facilities and the quick testing, and it's on the national news, and I did see a map over the weekend which identified must have been hundreds of testing locations in Massachusetts spread out all over the state. If people do want to test or get tested, I know they need to go through their physician and get approval, but where would typically people go to get tested if they live in Bellingham?
So it really depends on where you want to go. If you live here in Bellingham and your doctor's office cannot accommodate the testing themselves, they may recommend that you go to one of the urgent care centers, or the specific testing centers. We do have one in Foxborough, there's one in West Springfield, there is another rapid testing center up in Lowell, Mass, and then the hospitals, local hospitals, should also have access to that testing as well.
Great. Another question. Hi, I'm wondering, what does the timeline of the virus look like? Would someone who may have had the virus over a month ago still test positive, and would they still be contagious?
So that's actually a really good question, and it's totally dependent on the person. When you are exposed to the virus, you're exposed to a viral load, and it really depends how much of that viral load you're exposed to, which determines basically how sick you're going to get, in addition to any other contributing factors such as your past medical history and any other co-conditions that may exist. If you get a very large viral load, you tend to be sicker longer, which could result in you being testing positive more frequently and longer. In regards to the contagious factor, it is thought that if you go 4 days, 3 to 4 days without a fever, without using any Tylenol or ibuprofen, or you're at least 7 days from symptom onset, you're no longer thought to be contagious. However, it is advised if you're still testing positive, if you're retested, for example, 2 weeks later and you test positive again, we restart that 7-day clock, because it's really not known if you're still contagious because you're still testing positive, or if you've been re-exposed to a different strain of the virus and you got sick again. So unfortunately, without the antibody testing available, we really can't say for certain that, yes, you have the antibodies, you're good to go, you're no longer contagious. And we can't say exactly which strain of the coronavirus you have currently. It's just a matter of whether or not you're positive. Because to date, as far as I'm aware, there are about 8 different strains of the virus that are out and about.
Thank you, Esther. One last question. One of the trends that we've seen here in town and probably throughout the country is the majority of the cases in Bellingham anyway are involving first responders and people in the health profession. I know we jumped again since last week, about 6 or 7 cases. Does that continue to be the trend where the majority of our cases, the overwhelming majority, are people in healthcare and first responders?
Yeah, it's the first responders, the healthcare providers, and their families, unfortunately, are also testing positive. I've come in contact with a few people who have had no symptoms at all and ended up testing positive, and then some of their family members have tested positive as well.
Great, thank you. I had a question for Bruce. Really, it's a comment. Someone was calling in complaining about a couple of businesses in town they felt weren't practicing social distancing and weren't enforcing it. And I'll pass that along to Bruce. I'm not going to mention the businesses, but Bruce, when you get those complaints in, what's the follow-up as the health agent?
Typically, if I get a complaint, I'll go and talk to the store. Actually, I'll visit the store covertly and watch and observe to see what they're doing. In most cases, if I find something, I'll speak to the person at the counter or ask for a manager and remind them, of the safe social distancing practices. In one situation, there were a number of people sitting at a table, and I had to remind them that, we're not allowing people to sit and congregate, that, buy your product and take it and go and leave. So it's just a constant, reminder. I see it, I go respond, and adjust accordingly.
Good. I know the majority of businesses, we've had the grocery stores on, Home Depot, they do a great job with marking the flooring, and people know the aisles for the most part are all one way. Registers now are every other register, so they've certainly responded in a big way. I had one other question for our town clerk, Larry Spizzato, and I'm going to put him on the spot because I didn't mention it to him ahead of time, but would you be prepared to just touch on the election dates? I had someone asking about election dates as far as registering the vote and also the date itself for the elections themselves. Yeah.
Yes, our election dates have changed for both the municipal election. It is now on June 9th. And our annual town meeting is on June 22nd. The last day to register to vote before the municipal election will be on May 12th. So
Great. And town meeting's also been changed to the 20,
June 22nd.
June 22nd. Right, great. Thank you.
Okay.
Just one other thing, pay attention to the town's website, www.bellinghamma.org, for the latest information. We update that constantly, so if you have questions on things like elections or any other matter, that information's there.
In the COVID specifically, email.
The COVID specific, yeah, the COVID-19 at bellinghamma.org, if you have a question specifically about COVID question that you want addressed in the morning.
Wonderful. Anything from anybody else in the room? All right. Well, thank you for joining us. Thank you, Courtney, for sharing some time with us. And we will look forward to seeing you again tomorrow. Please remember to wash your hands and social distancing, right, Bruce?
That's it. And if you got your mask, wear it.
Got your mask, wear it. Absolutely. All right. Have a great day, everyone.
Bye.